welcome to the Youth Enquiry Service Podcast. I'm Hannah, and we are here with Emily, who's from the Sexual Health D&G. Welcome along. We are very excited to have you here today. To start off, if you had to choose a musical decade, what would it be and why?
Thank you very much for having me. It was a hard decision. So my musical decade is the 2000s. And the reason because we've got some epic boy bands in that. We've also got Britney Spears. We've also got like female icons. 2000s has to be.
Great.
And what is yours?
I would probably say mine is like the 80s because it's got amazing acts like Stevie Wonder and stuff.
Yeah, I did think that one too, but sticking with the 2000s.
Great. So can you give our listeners a brief introduction of Sexual Health Dumfries and Galloway and what they would do in our region?
Yep. So sexual health is made up of doctors, nurses, healthcare support workers, admin, and our health promotion team, a health improvement officer, that makes our service run really smoothly. We see people for contraception, emergency contraception, STI testing, pregnancy concerns, pre and post exposure medication to reduce the risk of HIV. And we also do a lot of like outreach work as well, working with different groups like yourselves, so that we can sort of try and reach everybody that we can in our region. But obviously Dumfries and Galloway is very big.
What is your role in Sexual Health Dumfries and Galloway?
So I'm a specialist nurse in sexual health, and I've been there for about 6 years, and I sort of do all the medical side of things that I've mentioned before, just in the sense of like contraception, STI testing, and the medication side of things. So it's a really good job.
Great to hear. Can you tell us where the clinic is based?
So currently we are in Dumfries. So the Dumfries clinic is based just off the Craigs Road. So you're coming up the hill towards St Joseph's College, and we're just on the right hand side, or the left hand side, and we're in a bungalow quite around in there. It's quite secluded. There's not really many people that go around there, so that's where you can find us. In Stranraer, we are based in the Galloway Community Hospital, and that's on a Monday only. So that's the only time we're really in Stranraer.
What days and time is it open for the young people?
So at Nithbank in Dumfries, we have a specialist clinic for young people aged 13 to 18, and that's the only drop-in clinic that we have, and that's on a Monday. I'm just confirming the times because they sometimes change, but it's 3:45 till 5:45 on a Monday evening. There is obviously other, weekday appointments that young people can come to, but usually through the week it's done through telephone appointments, after speaking to somebody, booking online, and Stranraer on a Monday. So there are like where people can reach us, and also phone call. Like it doesn't need to be face to face; it can be over the phone as well. So that's what we have.
Thank you. Some of our young people might be scared to approach the clinic. What advice would you give to them?
Yeah, so that's completely understandable. Everybody feels a little bit of embarrassment when they come to see us, and because it is such a private thing and nobody really likes to talk about it, but we're in a role that we talk about it all the time, so it's a very comfortable thing for us. We're friendly, we're not judgmental, we're not there to get you into any trouble, we're there to listen, and quite a lot of people go, oh, that was actually not too bad. So that's the kind of atmosphere that we like to create.
As some young people like to know what they're going into, can you give us an example of the general questions that they may be asked?
Yeah, so we ask general questions about their medical health, like when they go to the doctor. So we ask them about allergies, medications. We then do go into the kind of more personal questions, but we're not asking them to be nosy. We're asking them to form a general assessment, and we ask about are they sexually active, when they last had sex, how many partners they've had, females, when their last period was. And then we also have this opportunity to do a lot of health promotion. So we ask about drugs, alcohol, where they live, just because that can impact their sexual health. We also ask about consensual sex, non-consensual sex. And for those under the age of 16, we do have additional questions that we like to ask them, like their school, their family relationships, how they are in terms of friendships, and all like the ability to consent. They're like the sort of main things because we want to keep our young people safe. So that's what the kind of questions to expect.
Thank you. What inspired you to become a sexual health nurse?
So I don't know. It's always been something that I've felt comfortable talking about growing up, especially like with friends. And when I seen the job come up, I was like, you know what? I'm just going to apply for it and see what happens. Because the time that I applied, it was quite like hard to get in. And I got it, which I was like, all right, okay. So no, I was just like, I'm going to take it. And it's been the best choice, best move that I've made. Because with nursing, there's loads of different things that you can do. So I started off in the wards and then the community, and then now I'm here. So it's actually, so I really enjoy it.
What does confidentiality mean, and what are your rights?
So this is a really good question. So confidentiality means that like your information, your details, or the reason why you were coming to the clinic would not be shared with anybody else. The Scottish Government sort of say that, well, they do say, they don't sort of say, young people aged 13 and over have the right to access contraception and condoms in confidence. However, there can be things that can come up that causes some worry about people. So we sort of advise people that we do try to keep everything in confidence. But if we felt that we were like worried about them, or if we felt that they were unsafe, or there was like a wider public safety concern, then we would have a conversation with them just to say, look, we want to get in touch with relevant people like social work or the police, just to make sure that, you know, you are safe. So yeah, we do have a duty of care as nurses to protect people. But in sexual health, it's not, there's different like thresholds, I would say. So we want to keep people engaging with us. So that's the main thing. That's the main thing.
Can you tell us about the free condoms by the post for young people in D&G?
Yeah, so it's actually a really popular thing. So condoms are available to anyone aged like 13 and over that lives in Dumfries and Galloway. And all they need to do is they need to go into the website, which is www.sexualhealthdg.co.uk. And they can choose the varieties that they want. And it's just filling out a short like application form. It's completely confidential. It even comes in like discreet packaging, so it doesn't come like, you know, marketed like at sexual health and things like that. They can be like posted to their home address, or it can be collected at like a home library, like the local library. So no, it's very popular. Very popular.
How can we encourage more open discussions about boundaries and respect within relationships?
So we know that young people these days are very aware of the importance of healthy relationships. So that's like friendships, family relationships, or romantic and sexual relationships. The good thing in terms of encouraging it would be to have good communication, equal say, compromise, respect and trust, and honesty, and also not putting pressure on each other, and just being aware of how like people's actions make other people feel. And this is like things that are taught like in early education in schools, but these messages are sort of reinforced by ourselves, youth work, rape crisis, so that by the teenage years we have a good understanding of it, and that's continued like through like Do the Right Thing, which has been happening in schools recently. But it's just important to always praise like respectful behaviour, and that's what we're aiming for. And you know, a lot of young people are, so that's good. However, there are still like negative influences out there, like sort of social media. So I think it's all of us to up to all of us to sort of call that out and just say, no, like that's not on. So yeah, sorry, long answer.
Sorry.
No, you're fine.
What kinds of contraception are available, and what are they available to?
Okay, so there's loads of different methods of contraception, ranging from pills to implants to coils to injections, and they're available from women up to from the age of 13 and over. All right, they're not every method fits all. They have their pros and cons. They have side effects, but a lot of the pros outweigh the negatives in the sense of, reducing the risk of an unplanned pregnancy to a woman that's maybe not planning a family at the time. We basically go through the conversation about what's involved with it all, and it's up to the individual as to what they would like to do. Equally, we are not there to sort of force anything. So if they choose something, then we don't say you have to keep that in. Like, we sort of have that discussion to sort of see if there anything that we could try first of all, or is there anything else that we could, try in terms of a different type of method. So there's loads of different things, and it's all the information's all on our website too.
Thank you. What do you do in an emergency, and what classes as an emergency when it comes to sexual health?
Okay, so emergency situations for us would be somebody that's had unprotected sex, that's not on a method of contraception or has had a condom failure, and they would be eligible for emergency contraception, and that's up to 5 days, so 150 hours maximum. But the sooner the better. Also, if there's a risk of transmission of HIV, and that's up to 72 hours. And also rape or sexual assault. So there are our emergency situations. So yeah, and we have processes in place to make sure that those people are seen quickly and receive the care that they need.
What do you offer for young people and who are a part of the LGBTQI plus community?
So one of the biggest developments in sexual health over the last few years has been the free medication for PrEP, which is pre-exposure prophylaxis medication that reduces the risk of transmission of HIV, and it's such an effective drug, basically stops them getting HIV. And the people that are at risk of HIV transmission are gay, bisexual men who have sex with men, but trans and non-binary people as well. So that's a really good thing that we can offer. Also, free condoms and lube through our website, just because these are essential to anybody that's having anal sex to make the experience more pleasurable and cause less trauma. Everyone's welcome to our service, and also on top of that would be testing as well. So they're more than welcome to come and see us.
Great. Do you think there is more information available to young people about sexual health now than there was 10 years ago?
Yeah, so there definitely is. However, there are some information that might not be as reliable. So Google, if you Google things, it can tell you loads of different information. So it can, but we would just advise people to stick to NHS website. So that's just like general NHS one, NHS Inform, or our website for sort of trusted evidence-based information. Yeah, some things can be quite scary. A lot of people Google before they come and see us.
Yeah. What role should social media play in sexual health education?
So that's like similar to like my answer before. There can be a lot of misinformation on social media. Unfortunately, there's a lot of influencers that are paid to promote things that maybe aren't so true. Some of them are really risky. Like one of them is most recently was the natural family planning, where you're taking your temperature, but in terms of to reduce the risk of having sex around your fertility window, but it's actually been quite a big failure, leading to sort of an increased risk of pregnancies around 24%, so it's quite high. But there are some genuine stuff too. I think it's just people having like, experiences of having their implant taken out on TikTok, and it does allow people to have that sort of, okay, well, this is what I could expect. But yeah, it's just being careful on the social media side of things, because they're usually being paid for broadcasting something as to, it has loads of benefits when actually it doesn't.
Yeah. What kinds of common STIs are there, and what are their symptoms?
So the most common sort of in terms of like a symptom, so our most common symptom that what we see is that people don't actually have symptoms. So people can come for testing and get quite a shock when they have a positive result. But our sort of common ones that we see are chlamydia, gonorrhea, we see herpes, we also see warts, also syphilis, and that's been on the rise recently, and that's in heterosexual couples, but also in men who have sex with men. So the kind of more common symptoms of like the bacterial infections, like chlamydia and gonorrhea, can be for both males and females. They can experience a discharge that's not normal for themselves. Males shouldn't really, or those who have penises shouldn't really have discharge coming out, pain passing urine, abdominal pain, and with syphilis, that can be like a painless ulcer that can be anywhere on the mouth, the anus or rectum, that can be there for about 2 to 3 weeks and it's not painful. Then it can sort of develop into like a full body rash. I don't want to scare people, but they're the kind of more like, they're the common ones that we see. Yeah, so we do see quite a lot, but they're all treatable, with antibiotics, especially the bacterial ones. We see a good, effect with the treatment there. So yeah, there has been a rise. So it's all about education and promotion of reducing that. So yeah.
Yeah, definitely. How can we make STI testing more accessible to our young people in the region?
So we're working quite closely together with the school nurses, so that those who wish to have a sexual health screen, that can be done through their school nurse. So obviously that will cover from Dumfries, right from Dumfries right to the Stranraer, and way past out west. So we're trying to do that. When sort of ages 16 and over, they can request a postal testing kit, and that can be delivered to their home address, or they could pick it up. So that's what we're kind of really trying to do for young people, and obviously our young people clinic on the Monday. So yeah, that's what we're trying to do, and I think the school nurses, they're so knowledgeable. They see loads of different people, and they can form relationships. And once the young person does it for the first time, it's easier the second time. If they do wish to be tested. So yeah, that's what we're trying to do.
Right. How can festivals like Youth Beatz help to promote sexual health awareness amongst young people?
So the Toon, is amazing. They do a really good job in terms of promoting sexual health through their, through what they do, and sort of raising important issues in memorable and fun ways. So that's a really good thing. And I think it's just like getting young, and then from that, it's also getting young people talking and getting the curiosity flowing, and sort of trying to just like reduce the stigma, and that it can happen to anybody, and yeah, no, I think it's just like sparking that curiosity from the festival, which I'm really looking forward to.
Thank you. And as our final question, what is your favourite part about your job and why?
Definitely working with people. All the patients that we see are so nice. They're always lovely. I think as well, when you build up a relationship with somebody that's come from when they've been a young person and seeing them into their adult life, yeah, everyone's got people are so interesting and their stories, and we can learn a lot from them. So that's the reason why I think. And it's not really, well, would it be a privilege? It is a privilege to hear about people's intimate experiences and what they're, and, but it also helps, us gauge, like, this is all normal. Like, it's all normal. So, yeah. Sorry, that's a long-winded question, answer. But yeah, that's the reason why I love my job.
Thank you. Thank you for being here today with us. It's been a great pleasure speaking to you.
Right. No, you're right.
Come back with us next week for more podcasts like this, and remember to follow us on all social medias.
Lovely.
Goodbye.
Follow us to keep up with more podcasts.